Hey team, welcome to today's video and welcome to my channel, or welcome back to my channel. My name is Hayden in the hospital. Since I'm in the hospital, I may as well just keep a document of what's happening. Now, if you didn't watch one of my previous videos, I did actually explain why I'm in the hospital, but in case you missed it, I will link the video somewhere up here. And if you don't want to go and check that out, then I'll let you know. Rewind about 2 or 3 weeks, maybe it was 3 weeks ago now, I had my first tooth extraction because it was rotten. And I had intense pain. I didn't know it was rotten because it looked fine on the bottom. It was up in the root. I had it extracted. It all went well. However, a few days later, it got infected. I went on antibiotics. A week ago, on Monday last week, I had a second tooth extraction. Now, this one had a really bad cavity and similar scenario. It was discolored, but it was not good in the root. That was extracted rather than saved. And then the dentist thought it would be best to put me directly on antibiotics just in case. I was directed to take a stronger dose than the prior one, and more of it. So 3 times a day I had to take amoxicillin, whereas the previous round was only 1 day. I was supposed to take that for 5 days. I lasted 3 days and 1 pill. So 3 and a little bit. And that was because I started to develop abdominal issues. I had cramping, really bad gas, runny diarrhea, which then turned bloody. So that I started noticing that on the Wednesday. Fast forward to the Friday, I was experiencing all of those symptoms, but as the day progressed, it was increasingly getting worse and worse and more painful. Come Friday night, it was around midnight, I was frequently making trips to the bathroom, and it became less and less actual diarrhea and just blood. And the pain was excruciating when it came on. There was a point where the pain was so intense, I couldn't breathe properly. The sweat just came off me in waves. I've never experienced, and I teach fitness classes, high energy fitness classes, and I've never experienced the sweat just running down my face just from walking from my bedroom to the toilet and sitting and trying to push a teaspoon or tablespoon of blood out. My partner on Saturday morning, when he woke up, I informed him and he called an ambulance. Ambulance came out and collected me. And they took me to the hospital, did a series of tests. I was admitted into short-term stay in the emergency area. They ordered a CT scan. They did contrast. The CT scan showed that I had significant inflammation in my large intestine, all the way through my bowel, but more specifically in the large intestine, in the right descending portion of my large intestine. Within that, they also found that within the folds of the right section of the descending intestine, large intestine, there were gas pockets, which usually would indicate that the bowel had started to die. When I was delivered that information, it was 1 a.m. on the Saturday morning. I was admitted Saturday 12 p.m. 1 a.m. I was woken up by one of the surgeons who delivered the information to me and said that this is what we found. They took another round of bloods. I had to give another stool sample. He mentioned that, at 1 a.m. mind you, he mentioned that they are considering removing the section of bowel that's affected, which would mean that I'm going into theatre, into surgery that night. Okay, pausing there. I forgot to mention, so when the doctor did come in and he presented 2 possibilities. So possibility number 1 would be they would just start me on a round of antibiotics and wait and see how I go. Or option number 2 would be they're going to forego the antibiotics and go straight into looking for a colonoscopy or a camera to check out what's happening on the inside, because there's only so much they can determine from a CT. And then they would make a surgical plan from there. Obviously it's 1 a.m. I can't call anyone to let them know. I tried calling Adam, but he was asleep. He had to work in the morning. I sent him a bunch of messages. I can only imagine what that must have been like to receive in the morning. First thing in the morning, not knowing. They admitted me into my own private room, which is where I am right now, and have been for the last 4 days now, and put me on a round of liquid antibiotics. It has been a really major improvement since they put me on the liquid antibiotics, and I've not had to have surgery as yet. I have however, had many needle sticks because apparently I've got difficult veins for them to find. And I'll show you how many I've got. As you can see, as it starts to focus, I've got all of these. I've got the current one, and that one right there, that's on my left arm. On my right arm, yeah, I've counted them all, and I've got 21 needle sticks. That one, and then this most recent one, which hurt like a bitch. Now, because I'm still on the IV and they're still really concerned with my inflamed bowel, I am only on free fluids, which means I cannot eat solid food. This is my lunch, and that's because I'm on free fluids, which means I can't eat anything that's got solid food particles in it whilst I'm still in the hospital. Veggie broth. There is no salt and pepper. They did provide it. Small orange juice and soy milk. What I'm gonna do with that, just a carton of milk, I don't know. And that's almost 5 days in now. Because the first 2 days, almost 5 days in with no solid food. The first 2 days, I had just fluids, just the IV. No free fluid at all. For the last 3 days, I've been on, well, almost 3 days, I've been on free fluid, which means I can have the juice and what you've just seen in the previous clip. Am I hungry? Oh, yes. Why, yes, I am. I think the nurses are having domestic out there. Okay, so while the nurses are having a domestic, this is my room. The door, little seating area there. The one and only window, and you can see me in my wonderful gown. I do have shorts on. You can see that's my view. There's a giant tarp there, and that's because the staff area is right outside. I've got my bed. There's a little cupboard there. Obviously the bed table that can be wheeled over the bed and put away. And then what I'm attached to all the bloody time. It's currently in my wrist. I've got the bedside table. And then if we come through here, I do have my private bathroom, which I'm very thankful for. I've got the shower, all my amenities, and the basin. As things progress, I will no doubt keep you informed, but here's hoping that this will be the final day that I am, or the final full day and night that I have to be in the hospital. I do know that I'll be in the hospital tomorrow because the surgeon said to me this morning, hopefully just 1 more day. But I do hope that that's the final day because we have the Easter long weekend, a 4-day weekend coming up. We have plans, which I don't think I will be maintaining the eating plans that we had arranged. But I'm hoping we're still able to do at least a portion of what we had planned. Thanks for watching, team. Make sure we do the fun stuff, but more importantly, stay tuned.